I'm joined today by Martina Becher from her native Germany. Martina was trained there as a clinical psychologist and has practiced for the last 20 years. And for the past 7 years, she's trained and has practiced neuromodulation technique. Martina, welcome. It's good to see you again.
Hi, Les. It's a pleasure being with you.
So, Martina, it occurs to me that viewers watching this may find it kind of curious that here you are, a psychologist from the region of the world that gave birth to psychology, but a big part of your practice, working with people with emotional and psychological problems, is neuromodulation technique. And the question comes up, what does neuromodulation technique bring to your practice and to your patients that makes it a unique service?
Well, I understand your NMT as a tool that can be used for all sorts of problems. So it is logical for me to try it on psychological problems as well as physical problems. And when I started using NMT, I found that people responded very quickly and that their suffering diminished within a very short time. So this made me feel great, and it made them feel great. So I started using it, and now I'm using it a lot of the time, and I find that we're getting great results. The clients get great benefits from using NMT, and it's a pleasure to work with this system.
So maybe you could contrast what you see in terms of your clients' progress when you're using NMT as compared to how things go when you use more of the cognitive therapy, psychological tools that you're trained in.
Well, I was actually trained in depth psychology and in Gestalt therapy. And especially Gestalt therapy is a process which can take quite a long time. It's a process where people have to go deeply into their feelings, have to relive and imagine problems in order, how things go, and role play a lot. So there's a lot of work involved in this for the client and also for the therapist. And in the depth psychology, you're always looking for the reason somewhere, and you're hoping to find the reason for the problems in order to find solutions.
So for your clients, when you're using those psychological techniques, you really have to draw them through that traumatic historical experience again and again in order to bring them to a better place. And that, I take it, has some element of retraumatization for them.
One of the key elements is that it takes a long time to create change when you're using these methods. And that often clients actually feel worse in the course of the therapy, in the course of the working with the therapist. So it takes a long time, and it's hard work, and it's very often very difficult to see changes within a reasonable time.
Martina, what kind of timeline are we talking about when you are speaking of prolonged therapy for clients using these traditional psychological techniques?
Well, with the depth psychology, you can have cases that take up to 5 or 6 or 7 years. And with the Gestalt therapy, perhaps you have 50 to 60 sessions. So that's a long time. If you do 40 sessions a year, that's always 2 years or something.
That's a very long time, isn't it? Yeah. How does this compare to the results that you're seeing with neuromodulation technique?
Well, when I use NMT, the results come a lot faster. Like I was treating a young man, and he had a diagnosis given to him by a colleague of bipolar disorder. And I worked with him for 10 sessions. And after the 10 sessions, he reported that he was not depressed and he was not too happy either. So he had returned to a normal state of being. And this treatment ended 2 months ago. and he's still happy, and there's still the symptoms have not returned, and he's now leading a normal life.
And this is without medications, is that right?
Yes. It's just using NMT.
So a tremendous result. So instead of years, you're talking about weeks or a couple of months perhaps for this fellow.
That's right. Yes.
Wonderful. Martina, you mentioned something about the impact that neuromodulation technique has on you as a practitioner in terms of your workday and what that's like for you personally. Perhaps you could say a little bit about that, because I imagine that the requirement in traditional psychology to bring a client through this traumatic history is something that you share with them to a degree when you are using those kinds of therapies. How is the experience of practice different for you when you're using neuromodulation technique as compared to psychological methods?
So if we're talking about like trauma, and the client relives his traumatic experience, all these massive emotions come up, and you as the therapist, you're actually there in the field of the emotion as it is. And of course, the client speaks about his trauma, he talks about his experience, and you have to hear all these things. So when you're working with serious trauma like childhood abuse or very bad accidents or whatever, this means that you are actually in danger of being traumatized yourself. So this is called secondary traumatization. And it can lead to the fact that you don't sleep at night, that you become depressed yourself, that you lose trust in the world as a good place, and that your whole attitude towards life changes. And of course, this doesn't happen when your client doesn't have to tell you the story, and your client doesn't have to go into the problem in order to get better. And even the modern treatments like EFT or EMDR, they do involve a part of client having to go into the problem, having to sort of relive it. And that still means that you as the therapist are there guiding him or her through the process. And yes, you're actually in the field of this emotion, which is distressing for you, for some more, for some less. But in generally speaking, therapists working with traumatized people often report that they get very tired and that they do have a hard job, which is nothing the common therapist will actually admit, because we have to be the ones who solve other people's problems. So we don't say, well, your problem is a problem for me.
Of course.
Yes. And in NMT, this is a lot different. Why? Because the client doesn't have to go into his problem. What I do is I invite the client to think about the problem. And then just for a short second.
Just to reference it, you might say.
Yes. And then I tell him to think about something nice. And then I do my NMT pathways. And I check with him, how is the problem now? And what I usually find is that within one session, the levels of distress reduce greatly.
There's subjective distress when you ask them to again think about the problem.
Yes. And this is subjective distress. Please pardon my English, it's not so fluent as it should be, but there we are. But I'm working a lot with horse riders, ladies who fall off horses and break bones. And the latest lady I worked with, I'm still working with her now, I said, I give you half a session, half an hour, so you know what I'm doing and we see how it's going. And she said, yes, that's okay. And one of the things that happened after one of her accidents was she broke a little finger. And from there on in, she could only do the fingers like this. Yes?
Yes.
So this is what it was at the beginning of the treatment. Half an hour. And at the end, we didn't even address the accident when this happened. We just address the other accident, which was bad for her. And at the end of the session, she could do her hand like this after half an hour of treating. So this is not a question of subjective levels of distress, is it?
That's quite objective and almost instantaneous, which is amazing.
Yes, yes, yes. And so these are the things I expect to see nowadays. I expect people to feel a lot better after an hour, and pain that comes from that was there after a traumatic event to be less intense or even gone. And that's something that was unbelievable to me before. Because
prior to NMT, you simply would not see those kinds of results, and certainly not that quickly.
No.
So you bring up something interesting, which is that psychological issues often have physical correlates in the body. People often have physical complaints coincident with their emotional or psychological stress. And perhaps you could say just a little more about some of your experiences with physical problems by using NMT to address the underlying emotional disturbance.
Well, I usually work with people who come to me with emotional problems. And as the body has a memory, and every cell has its own memory, we of course have the emotion somewhere in the tissue, in the body. So if somebody comes with a psychological problem, I always ask, and where do you feel this in your body? So I take it from there. I don't get people who come to me with actual physical complaints. They don't come because they got backache. They come because they're nervous, frightened, depressed, or traumatized.
But coincidentally may have physical symptoms that go with those psychological symptoms.
Yes, yes. And then I find that those physical problems clear up or at least improve quite a bit. Like the lady, well, yes, one of my clients, I don't know whether you call tinnitus a physical problem or a psychological problem, a psychophysical problem.
That sounds like a good term.
Yeah. And she came and she said, I have this noise in my ear, it doesn't go away. And at the same time, I've got these worrying thoughts. So we started working on the worrying thoughts, which then got better. But the tinnitus, it was still there. So I said to her, well, why not address this directly? And she said, oh, you mean we can? So yes, we did. And after the session, the noise in the ears was gone. And
one session, is that right?
Yes. Yes. Even so, I haven't seen her since. And when I see her again, I'm going to check whether they have returned or not. Because the problem is not only solving the symptom, but solving it so that it stays away. It doesn't return. So, and I find that with using NMT, the results, they are quite stable. So once the problem is overcome, the symptoms also stay away.
And the results, not only faster, but stable results are something that, again, distinguish the results you get with NMT from the results you get with psychological therapies.
Psychological therapies take a lot longer to get stable results. Because with NMT, we enhance the psyche's ability to heal itself. Just like we enhance the body's ability to heal itself. And there's another thing, that is the correlation between psychological problems and physical problems. What do I mean? I mean, if a person is allergic to like milk protein, one of the symptoms may be depression, feeling depressed. So when somebody comes into your office and says, I'm very depressed, and you're a psychologist, psychotherapist, you then try to work out all the issues that make this person depressed. And if after 50 sessions he's still depressed, you become depressed as well. And the secret may be that he's actually not depressed because his life is so bad, but because he's allergic to milk protein and keeps drinking milk. And when using NMT, which is a holistic method, you may find that there could be some underlying allergic behavior, and you could work with that to train the immune system not to behave in this way, and at the same time find that the depression clears. And that's fantastic.
So with neuromodulation technique, you not only have a way of directly accessing and influencing very quickly and efficiently these emotional and psychological problems and the physical issues that come along with them, but from the other point of view, you can directly influence physical problems from which emotional and psychological issues may flow. A powerful tool.
Yes.
Martina, maybe you could say a word that might help other psychologists who are viewing to understand the training, the transition that you went through to integrate NMT into your practice. How long did that take before you were able to use it as an efficient tool to help your clients?
Well, when it started off, I took the training, and I found it strange because I was obviously understanding it on my psychological background.
Yes.
So the networks weren't there. And it took quite a while for the networks to establish themselves. And I started treating people with allergies and things like that, so that went smoothly. And I started treating animals, and that went smoothly. And then one day I thought, well, if this works, why shouldn't I use it on somebody with anxiety problems? So I did. And it started from there, and it grew. And now it's a major part of what I do when I work with people. But you need to get into the understanding of NMT, that we don't look for causes, we don't look for reasons, we are not interested in stories, we don't want to convince our clients that they have to work in a different way to make their lives work. We just concentrate on helping them. And we find that this help comes very quickly. So
this is, I think, a good point to reinforce, which is that rather than looking for a justification or a reason that the client is in the condition that they've come to us in, rather than that, the NMT point of view is simply that the client has been locked into some sort of physiology, whether it's emotional, whether it's physical, whether it's immunological, and our process simply frees them from that physiological fixation and allows the mind-body to work in a fluid, dynamic, and appropriate way.
Yes, and then this may come as a great surprise to the client, who suddenly feels a lot different after 1 or 2 sessions. When somebody who's fallen off a horse is now afraid of horse riding. And after 2 sessions, she says, well, I've tried it and I'm not as afraid anymore. I'm actually feeling a lot better about it. And after another session, she says, well, I'm actually not afraid at all. And I'm doing the thing again, and I'm happy doing it. Or a lady who was in a long-term relationship, and then this relationship broke up, and she found herself a boyfriend, and the boyfriend didn't suit her ideas. He was not the ideal person. And she came to me and she wanted to change him so that he would be the ideal person, because she felt she couldn't be alone. She couldn't be alone, and she didn't want the other one back, and he didn't want her back. Now she was stuck with this. And we did 1 session, just 1 session of NMT, and then she came back and she said, well, I don't feel as addicted to him anymore, to the new guy. And I also see that he's a different person from me. We're not the same. And after the third session, she said, oh, I've split up and I'm happy and I found that he's not the right person for me and it's okay to be on my own for a while. And I think that's a great result.
That's a tremendous result and rapidly gained insight through this neuromodulation approach.
Exactly. So the people who come and they're stuck in their depression or they're stuck in their addiction or in their bad relationship or whatever, and their whole ideas go around this and they can't think about anything else. And then 2, 3, 4 sessions, they suddenly see that they have a different point of view and they can develop from there. Or the lady who developed the fear of being locked in small rooms, agoraphobic. She couldn't go in the lift, she couldn't go through tunnels, she couldn't go in a cable car, and she was a drummer. Or she still is a drummer.
This is an enormous problem for people and sometimes lasts a lifetime.
Yeah, exactly. So, and it grows.
What was your...
it's worse and worse all the time.
Yes.
This can happen.
And
so we did a few sessions of NMT. I asked her to imagine being in a lift or something or going through a tunnel. And it took 3 sessions and her problem was gone. And she had to go on her gig in Switzerland up on the mountain. And she had to go through tunnels. She had to use a cable car and it went perfectly. And I think that is a great result.
I understand that many of your clients are from your local area, but you actually work with clients from around the world. Is that right?
Yes.
And these are clients that don't necessarily need to travel to your office. So perhaps you'd say a little bit about the experience of using NMT on a remote basis and how that's done and how the results compare with in-office use of neuromodulation technique.
Well, I use NMT a lot with remote treatments, and we actually work on Skype, or if that's impossible, via telephone. And I find, and my clients find, that there's no difference in the effectiveness, and that working on a remote basis is just as effective as it's working in the office.
So that opens up all kinds of opportunities for you and your practice, but also for clients who may not be physically close to a neuromodulation technique practitioner.
Yeah. Well, one of my clients, she lives in Münster, and she actually came to me because she was suffering from hay fever. So whenever it started that the flowers came out and the trees were in blossom, she had to sneeze and it was very bad. So one year she came here and I treated her here, and since then I did the treatment over the telephone and it was very effective, and we find that now she needs 1 treatment once a year, maybe 2 sessions, so the symptoms all disappear again and she's very happy. And others from Switzerland or all over Germany and Holland and other places, they phone me and we work via Skype, so they don't need to come. And yes, in my own treatment, you treated me from the US.
That's right.
And it was effective. I'm still alive.
And without food allergies, we might add.
Yes, hopefully.
Yes. So, yes, this is one of the big advantages of neuromodulation technique, is that it opens up these possibilities for both the practitioner and for patients, and they're no longer bound by geographical limitations.
And that's fantastic. I mean, that's really great stuff, isn't it?
It is fantastic. It opens up a whole new world for us. The stories that you've shared with us have no doubt piqued the interests of psychologists, and perhaps you could say a little bit, make some recommendations that might help a psychologist better understand NMT and whether or not they'd like to study it and make it part of their practice.
Well, the first step, there could be 2 first steps. One step could be going to a seminar, an NMT seminar, and listen to it, take part in the seminar and see what happens. And the other step could be finding a problem that bugs you. Everybody has problems, don't they?
I think
and
so.
Psychologists also have problems that bug them. And find a practitioner, an NMT practitioner, and work on the problem and see what it does and see if the problem changes. I mean, in psychological training, we always have this aspect of self-treatment, of self-development, of getting to know the method we're working with. This is actually part of our training. That's what we're used to as psychologists. So we should use this in NMT as well. Just to put ourselves in the seat of a client for a few sessions and then see what does it do for me, and is that something that I could wholeheartedly offer my clients, and if so, take the training. This is a typical psychological training procedure.
Yes, and in this kind of situation with neuromodulation technique, it's one that would give an answer very quickly, perhaps only a few sessions.
Yes, yeah. And if somebody is really interested, I'm always open to a telephone call or answering questions via email or Skype. So.
Very good. And so folks who are interested can contact you directly or contact the NMT office, and we can put them in touch with you.
Yeah.
Wonderful. Martina, thanks again for joining me, and I think we've done a lot in our interview to illuminate this area of NMT and help people understand that it's not only a very practical, comfortable, but very efficient and quick way to change some of these very difficult psychological and emotional challenges, and also to clear up some of the physical complaints that go along with them.
Yeah, and to give people hope that there indeed is hope for them, and they don't need to be stuck in this depression, and they don't need to commit suicide, and they don't need to fear life or themselves. Thank you for having me.
Thank you, Martina. Bye-bye.